I just completed my first clinical placement for my continuing care assistant program in Saskatchewan, and I was going to share my experience anyway, so I just thought to make this video to give you guys, especially people who have been watching my videos about my CCA series I've been doing for a while now. So I'm going to talk about my experience and see if it's something that I can share and if it can help anybody who is also preparing to come in here to study. And so I'm going to be talking about my experience, the things that I went through, whether or not I'm going to do this after I'm done with school, and things that you should be expecting if you are also interested in coming to study also as a CCA, and how do you determine if it's something you want to do for a living. If it's something that you'd like to keep watching, or you're just here for story time, which is basically what this video will be about, keep watching. My name is Susanna. Welcome to my channel. Right, let's get back to the video. For anybody who's just coming in for the first time to this channel, welcome. I'm gonna give a little bit of a backstory. My name is Susanna, like I mentioned earlier. I am currently studying to become a continuing care assistant, which also means personal support worker, caregiver, healthcare aide, depending on whatever province you are in. The main point is that I am studying to become certified in being a caregiver to people who are in need of other people supporting them with care, especially personal care and a little bit of medical care, just a little bit of it. So it is also in line with the healthcare category in Canada. It is very sought out right now. It is a profession that is very sought out right now, especially with the lot of more old people moving into care homes, and not just old people, really people who need intensive care due to surgeries or injuries or illnesses. So they need people who need to care for them in their homes as well. So they employ people like me and nurses as well to help them with, you know, providing care for them. So that is why it's most sought out right now, especially in the healthcare category. Last month there was an home care pilot program for people who are healthcare workers, caregivers, to come into the country to become home caregivers or support workers. It was a unique PR opportunity, especially if they've already had the work experience. The program came quickly and it closed quickly, so even before I wanted to make a video about it, it was already closed, and I thought it wouldn't make any sense to make a video about something that already closed. But I have a belief that they might still bring it up maybe later in the year or next year. So if it's something you're really interested in, I would advise to go into the internet, check their IRCC website to get more information about it, see if you have all the criteria they're looking for, and be prepared so the next time they announce anything, you apply very quickly, because it was really surprising. It closed really fast, but that's not what this video is about. This video is about being a student. Before you can work to be a caregiver, you need a sort of certification. So most people go to school to get it, which is what I am doing presently, and I'm already at my final stage in the program. One of the things you need to do is to complete your clinical placement, and my first clinical placement was at a long-term care home, and it took a few days, up to 3 weeks. It was a very interesting time for me. I'm going to dive into the things that I went through. For students studying CCA or anything under healthcare, you need to have like first-hand experience. So you go into places to do your placement. I think it's very common. Anybody who is doing healthcare would know that, because you need to get a little bit of education, hands-on education. So everything is not just classes or theoretical aspects, right? You need to get practical experience and practical education. So it was part of the things that you needed to do to be able to complete the program. So if you're planning to come in to CCA right now, you might want to keep watching this video. So what are the first thing I experienced? So the work moves really fast. It is a fast-paced environment. It's it's you coming in very early in the morning as a student. So I'm going to focus on being a student. When you start working, it's a different thing depending on the shifts that you're in. But for a student, you need to come in the morning. My experience, so we went in the morning, we joined the staff, the team in the health, we joined the team for the AM care. AM care means morning care. It made no sense for students to be coming in at night because there's not really much to do apparently in the night because most of the residents will be asleep, so you wouldn't really get a lot of education compared to you coming in the morning. I think this is very obvious, but I just thought to mention that. So we went in for the AM care, and it's very interesting. Though they treated us like we were already working, but of course there were things that according to our syllabus that we're not allowed to do. Things like bowel care, things like giving them bowel care means like giving them suppository like enemas. We're not allowed to take their vital signs. We're not allowed to do blood glucose monitoring, things like that. Things that you're not, it's just it's not things that we're allowed to do as students. You can watch, you can ask questions, but we're allowed to do personal care, we're allowed to do grooming, we're allowed to, you know, port them to wherever it is the resident wants to go, maybe their rooms, into the dining rooms for their physical therapy, whatever it is. You're allowed to do things like that, but you're not allowed to do certain things as a student. You're just allowed to watch. The first day we're just told to observe, so we were partnered with another CCA that is working, right? So each CCA has another partner, so it's like 3 people to 1 resident. So we're watching them. First, it was interesting. We're not allowed to do anything, so we're watching them do things, and we're completing personal care. Personal care means you most of these people who are in long-term care, they can't do these things by themselves, so you clean them up, you so facilities bathe for them. But in the facility I worked at, there was a designated CCA that would handle that. So after doing personal care, you take them out, after dressing them up, talking to them, asking them questions, examining their body if they have any sores or any injury, pain, and then you report it to the nurse who would handle the care for them because it is medical. So ours is to do the physical things. So you clean them up, get them dressed, take them into the dining room to have their breakfast, and then first day we weren't allowed to do anything, so we were just watching. But the second day we were told to join in, of course with the assistance of the CCA, because you're students, right? You don't really know much. So so it depends on the partner you are with. Some will show you the ropes and, you know, ask you to join in, and some will just tell you to just keep watching to see to the point where you're confident enough to do it. So they ask you, are you confident? If you're confident, fine, but it is better to just try. That way you will learn faster. So because there's a way you lift people on the bed called TLR. I mentioned in one of my previous videos. We were already trained to do it, but we hadn't really done it in a setting like that. So yeah, it was very interesting. The work is like clockwork, very fast paced. You are attending to a lot of people, and you need to get them to the dining to eat in the morning. So you need to be fast with your work. So the first I was very intimidated because of course I've already had experience being a caregiver, but this was different. I hadn't worked in a facility. Most of the places where I worked were home care, and to be honest, it's quite different, and it depends on the stage where the resident is. The people that I used to work with, they were sort of independent. Here they're not independent. The people who've had dementia, people who are suffering from chronic illnesses, people who are old really and they need support. So the care is different. It's really different. So you need to listen to your CCA partner and see the things that each client, each resident wants. Every person is different, so you cannot say what happened, what you did for the person in this room is the same thing you're going to do for this person. It is, it is client-centered care. It depends on what this person wants. That's what you're going to do. And as a CCA, you have to know each of your residents. You have to know what they need. You have to know what activities they're going to do for the day. If this person is going to go on a bath today, you need to prepare them so that when they get to the bathroom, the bath lady would not have to start all over again, undressing them, things like that. So you need to know what this person is doing. Are they going out? If they're going out, then you need to dress them appropriately. If they're going to see the doctor, you need to prepare them so that they wouldn't miss their appointment. If they're just going to hang out in the house or in the home, you need to, wear appropriate clothing for them. And if they need to go to the bathroom, you need to assist them, especially those who are still a little bit not independent, but they can still move around with walkers compared to those who are in wheelchairs. So yeah, that was the part of the morning care. And once we were done, we would go in to see our instructor. Of course, your instructor will come in and see what you're doing, so because you need to be evaluated to see if you are learning, and if you are not learning, we need to put you through to somebody else to help you out with it. Moving to what you, a CCA student or somebody who is interested in this kind of job, what you should expect. If you are working for a patient who is on long-term care basically means that they're going to be in that facility for a very long time because they have chronic illnesses. So palliative care is sort of like an holistic care for people. It doesn't have to be that they are old. It doesn't have to be a care. It doesn't have to be a care for people that are old, but it can go for any person. But there are people that they really need it because they have chronic illnesses. So you sort of go through this care where you take care of them. I'm trying to break it down into simpler terms, especially for somebody who hasn't heard this who is hearing this for the first time. So it depends on your patients, your residents' need. That's how you will be able to determine what kind of care you will give to them. So for a facility, each person has their own care plan. It's like a document containing everything you need to know about their medical history and things like that. What should you expect? You should expect that the people you are going to be caring for, they might not speak. They might not be able to speak. They might have lost their ability to speak. They might have lost their ability to walk. They might have lost their ability to communicate. So don't be surprised on your first day you meet someone who is aggressive, or you meet somebody who's docile, or you meet someone who is very hyper. There are just different kinds of people, and once you start the program, you will get educated about that. So it's not like you're going into your clinical placement with zero idea. That is why it's always put in at the end of the program, so that you've gone through the theoretical aspect, you've been taught things like this in class, so you wouldn't be that surprised once you get to your placements. So you're gonna meet people with dementia, you're gonna meet people with cancer, you're gonna meet people with different things, honestly, because you can't say now, not every long-term care, so every care homes are different. Some you don't need to work with old people, some you need to work, but mostly there are usually a lot of older people in long-term care facilities. So don't be surprised when you meet young people as well. Some people just need help. They need some families need other people to help care for their family members. It is not unusual, especially with the way this country is set up. So yeah, I just needed to say that. And be expecting that you're gonna meet a lot of old people. Like I said, do not be surprised. You're gonna meet people who are gonna ask you questions. You're gonna meet people who are friendly, you're gonna meet people who are not friendly, you're gonna meet people who are very quiet and shy, and you're gonna meet people who have gone through, they're already in like a severe level of dementia where they cannot actually express themselves. You're gonna meet people who are still ill and healthy, but they're just they cannot move around like they used to because they're already old. They're still alert in terms of their cognitive ability, but their physical ability is just dwindled. You're gonna meet people with stroke, you're gonna different people really. So you need to be prepared as a CCA student that you are here to provide care for each and every one of them. Yep. As long as you're assigned to them for that day. So, and you're gonna be feeding them as well. There's some that due to stroke they can't really move around. You know, they can't really use their hands like they used to, or they just, like I said, they've lost a lot of their cognitive abilities, so they don't really know what to do. So you're going to feed them, you're going to help them with their dressing, with their hair, bathing. You're also going to help them move from one place to the other. That's what the job basically is, helping people. And you get breaks. So as a CCA student, you go on breaks when your CCA partner / mentor also goes on break. So it was really interesting. The first day I got home, I was really exhausted. I was tired. I was like, oh my god, this is a lot. It was 8-hour shift, right? But it was really, it was first because it's a lot of standing up more than you sitting down, because you're always on your feet doing things, and I wasn't used to that. Most of the home care that I used to do, you would sit most of the time, because you're only attending to maybe few people, tops 3, 4, 5 people. But in a facility, there are a lot of people there. Now this depends on facilities. Some facilities they don't have a lot of people, and there are some that they do, so it depends on where you are. And I was just really exhausted. But at the end of the 3 weeks, I sort of got used to it. I wouldn't say that I wasn't still exhausted. I was really tired. There were days I'll come home and I'll be so tired. But then I'll think about it that, okay, you get 8-hour shift. You work like 4 days straight or 3 days straight, depending on your shift pattern, right? And then you get the rest of the weekdays off. And then you go home and you rest. And then you get paid. So it's something to think about. Like, is this something I want to do? Do I like the consistency of 9 to 5 for Monday to Friday and you get weekends off, or do I want to do like shift work and then get the rest of the weekdays off? So it's something I had to think about. Like, oh my god, considering everything I have going on with me, with my baby, do I need to have this kind of work pattern, or do I need to stick to 9 to 5? So those are the things that you need to think about as students, because you are doing this to get a certificate so that you can get a job, right? So think about these things. I get comments of people saying that they don't have healthcare background, that can they do this kind of job? You get trained to do it. It's not a lot of medical education. We're not administering medicine as CCAs. These are the nurses' jobs or doctors' jobs, whatever. We are just to take care of them in the physical way, and the nurses handle the rest. So while you are working in the healthcare facilities, you are limited in terms of things that you need to do. Yours is to take care of your client. You are their first point of contact. The nurses handle their medical needs. Yeah, so this is something you should also consider. If this is something that you've already paid your school fees for, you're going to be exhausted, you're going to be tired at the end of the day, but it is also fulfilling to see. I always tell the instructor that one of the best things to see is when you put a smile on their face, when you make them feel presentable, because most of these people, they're, it's a vulnerable state, it's a vulnerable position they're being put in. You're being put in this house, you probably will never go back home, and you have people coming in to look into you, clean you up every morning. It's a vulnerable state. You are there to provide support for them emotionally and physically, so you can talk to them, ask them what they want to do, keep them in line, keep them healthy enough, and talk to them, listen to them, and go on your break. That's what the job was about. So as a student, you're also going to do those things so that when you get your certificate and you start applying for jobs, you have an idea of what it is you want to do. So even if your workplace, your employer wants to give you orientation, at least you already know the things you are going to do. The thing I want to talk about that you should expect is the co-worker culture, because you're going to be working with people from different cultures, so there might be from different cultural backgrounds, right? So there might be a lot of miscommunication. There might also be a lot of people asking you questions, and it might come off as being too chatty, because why is somebody asking me questions about myself, about my personal life at work? So there needs to be like a balance, right? Especially you're a student, so you cannot be too all over the place. You need to observe more than you speak, and also at the same time you need to stand your ground. Don't let anybody push you around just because you're a student, because at the end of the day you'll be done with school and then you get your job and you're all going to be equal as employees rather. So understand the work culture in your facilities. See the way they do things before, see the way they do things before concluding and before being too forward. It is very important as students, because at the end of the day everything is about hierarchy, and we are at the bottom of the we're at the bottom of the food chain, right? So keep things very professional. If anybody has any issue with you, let them talk to your instructor. Then your instructor will get back to you and see if the things that you can improve, or if it's just being a bullying situation, right? So keep things very professional. One of the things that this experience has taught me is old age and how fast it comes at you. And while it is not very professional to sympathize with them, but it is very important for you to empathize with them. Sympathy and empathy are two different things. You do not have to feel pity for them. They are human beings. They had a full life before they had to move into a long-term care. They don't need your sympathy, they don't need your pity, but they do need calm down, but they do need you to empathize with them. Put yourself in their shoes and treat them the way you would like to be treated. It is very important. It's one of those things that they teach you as a CCA student. You need to be able to treat them like human beings, to be able to treat them like people with autonomy, no matter how less their cognitive ability has become. These things are very important, and yeah, it is very important that you see them as human beings. You see them as people. They had a full life before these things happened to them, and they need you now more than ever to help them out with that care. That is your job as a CCA. And even if you move up, maybe you go to study nursing or medicine or occupational therapy, whatever it is you want to do in the healthcare, you're still working with people. So always have it at the back of your mind that you are here to help them out, not for you to provide them with pity. They don't need your pity. Experience. And after I'm done with the entire placement, with the entire thing, I'm going to come in and give you more information. Now if you have any questions about the CCA again, and if you have any questions about how you can get a placement and like that, let me know. Of course, it is part of your program, so the school will handle that for you. But if you have any questions about the experience, because you are interested in coming to work here in Canada as a CCA or as a student, and you want to know, you just want information about it, text me under the comment section or send me an email like most of you have always done. I'll be happy to reply you, but it is always faster when you drop your comment. I'll get to it as fast as I can because it pops up everywhere on my phone. So yeah, that's the video. Thank you again for watching. Continuing with this CCA series that I have created, I'm going to be talking more about how to apply for permanent residency as a caregiver, and the category it is on the NOC, and how you can apply for the next draw, how you can be prepared for it, the documents you need, the things that are required of you to do, and yeah, how to come in and work here. So I'm going to make a video about that, and keep watching my space. If you are new, hit that subscribe button, press like so that you can get my videos. To get notified when I post anything, click on the bell symbol right there on your screen. You will get a notification every time I post a video. Thank you very much for watching. My name is Susanna again, and I'll see you in my next video. Bye.